In this video lesson, let's explore some of the prominent bony landmarks of the patella on the right side of the body. We have a number of views here. On the left side, we have an anterior view. On the right side, we have a posterior view. And up top, we have a proximal view. In other words, looking down on the top superior surface of the patella. Let's begin with the anterior view. First, for context, proximal is up here, distal is down here, lateral is to our left side, and medial is to our right side. The top aspect of the patella is often described as the superior pole, and the bottom aspect is described as the inferior pole. Other terms used to describe these two areas of the patella are: the top is often described also as being the base and the bottom as the apex. And this is because the patella has somewhat of a triangular shape. It's more pointed at the bottom, the apex of the triangle. Now let's look at the posterior view. For context, proximal is up top, distal is down to the bottom, lateral is now to our right side, and medial is to our left side. And just to be a little clearer, it's as if we're looking through the femur from the back side of the body, so we are seeing the posterior surface, the underside of the right patella. Over here, we see the facet for the lateral condyle of the femur. Over here, we see the facet for the medial condyle. In the middle is the vertical ridge of the patella. And again, the upper aspect could be described as being either the superior pole or the base, and the lower aspect could be described as being the inferior pole or the apex. Now let's turn our attention to this proximal view. For context, anterior is up top, posterior is down to the bottom, lateral is off to our right, and medial is to our left side. We are looking down on the superior pole, or we could say base. We can see the depression of the fossa for the facet of the lateral condyle of the femur here, and the fossa depression for the facet for the medial condyle of the femur here. And between the two facets for the condyles of the femur, we can see the outline of the vertical ridge. So this has been an exploration of the prominent bony landmarks for the patella on the right side of the body, with an anterior view, a posterior view, and a proximal view. Now that we've reviewed all of the prominent bony landmarks here, let's quiz ourselves. Pause the screen for a moment and see how many of the landmarks you can name.